The central message is simple, powerful, and true. Quitting smoking is one of the single best things you can do to protect and improve the health of your heart. It's a gift you give yourself, and its benefits will last a lifetime. Let's explore why this is so important and how you can make it happen. The connection between smoking and heart disease is undeniable and well documented. Every cigarette smoked introduces harmful chemicals into your body that directly attack your heart and blood vessels. Understanding this link is the first step towards making a change. This message emphasizes the profound and positive benefits that quitting smoking has specifically on your heart health. It's not just about avoiding future problems. It's about allowing your body to begin healing and repairing itself. The good news is that it's never too late to start this process. We want to offer you a clear path forward, a roadmap towards a healthier future where your heart is stronger and more resilient. This journey might seem challenging, but it is absolutely achievable. You have the power to make this change. The central message is simple, powerful, and true. Quitting smoking is one of the single best things you can do to protect and improve the health of your heart. It's a gift you give yourself, and its benefits will last a lifetime. Let's explore why this is so important and how you can make it happen. Let's delve deeper into exactly how smoking harms your cardiovascular system. It's crucial to understand the mechanisms at play to fully grasp the urgency and importance of quitting. Smoking doesn't just irritate your throat or lungs, it actively damages your most vital circulatory components. One of the primary ways smoking causes harm is by directly damaging the lining of your blood vessels. This delicate inner layer, called the endothelium, is essential for keeping blood flowing smoothly. When it's damaged by smoke chemicals, it becomes less flexible and more prone to problems. This damage creates rough spots where substances can stick. Over time, this leads to the buildup of plaque within your arteries. Plaque is a sticky mixture of cholesterol, fat, calcium, and other substances. This process is known as atherosclerosis, or hardening of the arteries. As plaque builds up, it narrows your arteries, restricting blood flow. This reduced flow means your heart has to work harder to pump blood throughout your body. If a piece of plaque breaks off, it can cause a sudden blockage. A blockage in an artery supplying blood to the heart muscle is what causes a heart attack. The heart muscle is deprived of oxygen, leading to damage or death of the tissue. Smoking dramatically increases the likelihood of this life-threatening event occurring. Similarly, if a blockage occurs in an artery supplying blood to the brain, it causes a stroke. Brain cells are deprived of oxygen, which can lead to severe disability or death. Smokers are at a significantly higher risk of experiencing a stroke compared to non-smokers. Smoking also increases the risk of peripheral artery disease, or PAD. This condition affects the arteries in your limbs, most commonly the legs. Plaque buildup restricts blood flow to the muscles, causing pain, cramping, and potentially leading to serious complications, like tissue death or amputation in severe cases. Beyond the long-term damage, smoking has immediate effects. Nicotine, the addictive substance in cigarettes, is a powerful vasoconstrictor. This means it causes your blood vessels to narrow almost instantly after you inhale. This constriction makes it harder for blood to flow freely. It's like trying to push water through a narrower pipe. This effect contributes to the increased strain on your heart. Nicotine also causes your heart rate and blood pressure to rise. Your heart has to beat faster and pump harder to overcome the resistance in your narrowed blood vessels. This constant extra workload puts significant strain on the heart muscle over time. Smoking also negatively impacts your cholesterol levels. It tends to reduce the levels of high-density lipoprotein, or HDL cholesterol. HDL is often referred to as good cholesterol because it helps remove excess cholesterol from your arteries. Lower HDL levels mean less protection against plaque buildup. Furthermore, smoking makes your blood more likely to clot. The chemicals in smoke increase the stickiness of your platelets, which are cells involved in blood clotting. Increased clotting risk means a higher chance of a dangerous clot forming and blocking a narrowed artery, leading to a heart attack or stroke. Considering all these detrimental effects, damaged vessels, plaque buildup, increased risks of heart attack, stroke and PAD, constricted blood vessels, raised blood pressure, reduced good cholesterol, and increased blood clots, it becomes clear just how profoundly smoking harms your heart. It's a constant assault on your cardiovascular system. Now for the good news, and it is truly excellent news. The moment you stop smoking, your body begins a remarkable process of healing and repair. It's not an instant fix, but the positive changes start happening almost immediately. This is where the hope and motivation truly lie. Within minutes of putting out that last cigarette, your heart rate starts to decrease. It begins to return to a more normal, resting pace. This immediate reduction in workload is the very first sign of your heart thanking you. Also, within minutes, your blood pressure starts to drop. It moves towards a healthier level, reducing the strain on your arteries and your heart muscle. These initial changes are small but significant indicators that your body is ready to recover. Over time, the benefits become even more profound. The risk of heart disease significantly decreases the longer you remain smoke-free. This isn't a small reduction. It's a dramatic drop that continues to improve over years. Your risk of heart attack and stroke falls closer and closer to that of someone who has never smoked. This underscores the long-term benefits of quitting. It's an investment in your future health. The damage caused by smoking doesn't disappear overnight, but your body's ability to repair itself is powerful. The longer you are smoke-free, the more healing can occur. Quitting smoking can genuinely add years to your life. By reducing your risk of life-threatening cardiovascular events and other smoking-related diseases, you increase your chances of living a longer, healthier life. This is a tangible and incredibly valuable outcome. Beyond just adding years, quitting smoking dramatically improves your overall quality of life. You'll likely experience easier breathing, improved circulation, better taste and smell, increased energy levels, and reduced risk of many other health problems. Your daily life becomes more vibrant and enjoyable. The benefits extend beyond physical health. Quitting can boost your self-esteem and sense of accomplishment. It frees you from the control of addiction and gives you back control over your health and your life. This empowerment is a significant part of the quitting journey. So while the effects of smoking are severe, the benefits of quitting are immense and begin right away. Your heart is resilient, and it is waiting for you to give it the chance to heal. This knowledge should serve as a powerful motivator as you consider taking this step. Now, let's talk about the practical side of quitting. We've established why it's crucial for your heart, but how do you actually do it? Providing practical advice is essential because simply knowing you should quit isn't enough. You need strategies and support. Let's be honest, quitting smoking is challenging. It's an addiction, and breaking free from any addiction requires effort, determination, and often help. Acknowledging this difficulty is important, but it should not discourage you. Because while it is challenging, it is absolutely achievable. Millions of people have successfully quit smoking and are now living healthier lives. Their success stories are proof that you can do it too. You are not alone in this struggle. Achieving success often requires the right support. Trying to quit solely through willpower can be incredibly difficult. Leaning on others, whether they are friends, family, or professionals, can make a significant difference. Support provides encouragement, accountability, and understanding. It also requires the right strategies. Quitting isn't just about stopping. It's about changing habits, managing cravings, and developing new ways to cope with stress or triggers. Having a plan in place increases your chances of success. Most successful quit attempts involve a multi-pronged approach. This means combining different strategies to tackle both the physical addiction and the behavioral habits associated with smoking. What works best can vary from person to person, so exploring different options is key. Let's look at some specific strategies that are often recommended and proven effective. These are tools and techniques that can help you navigate the quitting process more smoothly. Think of them as resources available to you on this journey. One crucial step is setting a quit date. This provides you with a concrete goal to work towards. It gives you a specific date to aim for, allowing you to mentally prepare and make necessary arrangements before you stop smoking entirely. Choose a date that feels right for you, perhaps one associated with a special occasion or simply a day you can dedicate to focusing on quitting. Identifying your triggers is another vital strategy. Triggers are the situations, emotions, or activities that make you want to smoke. Common triggers include stress, boredom, finishing a meal, drinking coffee or alcohol, or being around other smokers. Recognizing these patterns is crucial for developing coping mechanisms. Once you know your triggers, you can plan how to handle them without smoking. This might involve avoiding certain situations initially or developing alternative activities to replace the smoking habit. Awareness is the first step to managing triggers effectively. Seeking support is incredibly important. Talk to your doctor. They can provide guidance, resources, and discuss medical options. Consider joining a support group, either in person or online, where you can connect with others going through the same experience. Sharing challenges and successes can be very motivating. Don't underestimate the power of telling friends and family about your plan. Their encouragement and understanding can be invaluable. They can help distract you during cravings or simply be there to listen when things get tough. Utilizing nicotine replacement therapy, or NRT, is a common and effective strategy. NRT provides your body with nicotine in a controlled way, without the other harmful chemicals found in cigarette smoke. This helps reduce withdrawal symptoms and cravings, making it easier to focus on breaking the behavioral habit. NRT comes in various forms, including patches, gum, lozenges, inhalers, and nasal sprays. Your doctor can help you determine which type and dosage are right for you. NRT doubles your chances of quitting successfully compared to quitting cold turkey. Considering prescription medications can also be very helpful for some people. There are non-nicotine medications available that can help reduce cravings and withdrawal symptoms by affecting brain chemistry. These medications require a prescription from your doctor, who can assess if they are appropriate for your situation. Developing healthy coping strategies is essential for long-term success. Quitting smoking can be stressful, and you need alternative ways to manage stress and difficult emotions. Find activities that you enjoy and that can serve as healthy replacements for smoking. This could include exercising, which not only helps manage stress, but also improves cardiovascular health directly. Hobbies like reading, gardening, or playing music can occupy your mind and hands. Relaxation techniques such as deep breathing, meditation, or yoga can help calm cravings and reduce anxiety. Having a plan for dealing with cravings when they hit is also part of developing coping strategies. Cravings are usually intense but short-lived. Having a go-to activity, like drinking a glass of water, going for a short walk, or practicing deep breathing, can help you ride out the urge without giving in. Remember, quitting is a process, and it might involve setbacks. If you slip up, don't view it as a failure. Learn from the experience, identify what led to the slip, and recommit to your quit date or set a new one. Every attempt is a step closer to becoming smoke-free. The journey to quitting smoking is a powerful act of self-care, especially for your heart. By understanding the severe risks smoking poses and embracing the incredible benefits of quitting, you are taking control of your health. You are choosing a future where your heart is stronger, your life is longer, and your quality of life is significantly improved. This message aims to empower you with the knowledge and motivation you need to prioritize your heart health and embrace a smoke-free life. You have the strength within you to make this change. Seek support. Use the available strategies and believe in your ability to succeed. Your heart is waiting to thank you. Take that step today.